We're going to be talking about a specific parasite drug that reduces the relapses of multiple sclerosis and actually helps MS patients to remain steady. This was found in 2 double-blind placebo-controlled studies. So if we haven't met, my name is Pam Bartha and I'm the author of Become a Wellness Champion and the founder of Live Disease. And if you follow our work, you know that MS is caused by a parasitic infestation. That's what the research is showing us, and that is what people are doing to recover from multiple sclerosis. So I was diagnosed with MS over 35 years ago, and by the grace of God, I learned very early on that the MS was caused by parasites. And so now, 35 years later, we have served hundreds of people from all over the world. And I wanted to bring this research to your attention because it's really sad. This research has been around for a while. But what I really like about it is that this is a 2 double-blind, placebo-controlled, randomized studies where they have taken people that have multiple sclerosis and they have given them the specific drug, parasite drug, for one was for over 2 years, probably about 3 years, and another one was 4 years, and they noticed significant benefits from doing that. And this is very important. Before we start with those 2 different research articles, what I wanted to do is just help you to understand why double-blind, placebo-controlled, randomized studies are important. So when us human beings do research, there's a really good chance that our biases are going to influence the results of a study. So this is where we hope something is going to work, or maybe we expect something to happen. And so if there's ways that we can reduce the bias that would be present in our studies, then our findings will be much more accurate. So whenever we're looking at scientific studies, a double-blind is really important. Placebo-controlled is very important. Randomized is very important also. So double-blind means that the researchers that were giving out the treatment, whether it's placebo or whether it's the drug, they didn't know which patients were getting it. And then placebo-controlled means that we're not just giving one group of patients a specific treatment. We are giving one group of MS patients, so both groups have to have MS, and one of them will get the drug. The second will get a placebo, meaning that it'll be like a sugar pill. There won't be any medication in it. So this is taking out some other biases. And then a third way to protect the integrity of a study and to really make it more valid is to have it where the subjects that are picked for the studies are randomized. So we're not just picking MS patients to go on one side of the study, that let's say that get the drug, that live in a certain part of the world, a certain part of a country, and another group of MS patients that might live in a totally different part of the world. So you want to randomize the subjects in either group from, age, as much randomizing that you can do. And you don't want the researchers or the people that are receiving the treatments to know if they're getting the treatment or placebo-controlled. And then also whether they're getting the sugar pill or the drug. And then the third part is that you're doing it over a long period of time. So 2 to 4 years is a fairly good study. And the number of people that are in these studies, it's not huge, but it's significant enough to be able to get some information from this. So the first study that I wanted to bring to your attention, and this is 1982, and we're going to talk about why these studies are quite old and why there isn't a lot of further research on these topics. But 1982, this study, it was about a 3-year study, and it was published in the Journal of Neurology. And the title of the study, you'll find all of this information on our blog post, which we release usually on Fridays every week. So make sure that you are on our list. You can do that by going to livediseasefree.com. You'll see an opt-in there. If you want to watch my masterclass training, you can watch that, and that gives you more information about how we treat parasites. But then you will also receive our newsletter, and our newsletter will have the most recent blog posts, so all of these notes, the links to the studies, and also all the information about this topic will be found there in video and in written format. So some of you like to read, some of you like to listen to a video. And I always condense the video there also. So this first study, a 1982 study, and it's called Modulation of Immunity in Multiple Sclerosis, a double-blind Levamisole placebo-controlled study of 54 patients, 54 participants. So before I move further, I just want to make a disclaimer that I am not saying that this drug is a cure for multiple sclerosis. What I am saying is that the results of these two studies really help to point us in the right direction that multiple sclerosis is caused by parasites, because the findings of these two studies is tremendous. And in our students, they get energy tested to see which of the treatments test well for them. And they will usually test well for 3 to 5 parasite drugs at one time. So that is the really important thing to know, is that it's not just going to be one magic pill. Because remember, when we have multiple sclerosis or any other serious chronic disease like ALS, PLS, Parkinson's, we're in a state of dysbiosis, meaning that we're really out of balance. We have more than one type of parasite involved. But this is still a really huge clue. So I just wanted to share with you too that I'm at a different location today, and these beautiful paintings behind here, those are paintings done by my dad. He's done so many beautiful paintings. All us kids, we have amazing paintings in our home, and I always just like to brag about him because I love him so much. So this first study, the 1982 study, was done from January 1976. It was conducted from January 1976 to September 1979. There were 54 participants in this study, both with relapsing remitting and with progressive multiple sclerosis. The patient received a double-blind medication. So they received something, but they didn't know if it was the actual Levamisole medication. So Levamisole is a parasite drug. We'll talk more about Levamisole in a few minutes. But they would get a daily dose per day. They would get treated every day with Levamisole or a placebo, and the doctors or the researchers didn't know, and the patients didn't know who got what, for a full year. So daily for a full year, and then the treatment plan changed to be 1 dose per week versus 1 dose per day. So the double-blind medication was randomized, so meaning that, again, it wasn't like, it was really randomized so that we're trying to get rid of all of the biases that would influence the outcomes of this study. The patients were assessed at the start of the study and then every 3 to 4 months. They had minor adverse effects, nothing serious. Some skin, maybe some people had skin rashes off and on, not the whole time, but you might get a little skin rash, some nausea, some vomiting. Usually what we found is at the beginning, using parasite drugs, you might notice some adverse effects because you're killing off the parasites. But keep in mind, these poor people, they did not have any instruction on how to change their diet and how to get ready to treat and how to feel a lot more better before they start treating. They literally were just given a parasite drug or not given a parasite drug. So they didn't change anything other than taking this parasite drug. And very minor adverse effects. And they found that this drug restored T cell function. So remember that with a lot of the MS drugs, what they're doing is they're giving us medications that would decrease our T cells or our B cells. Those are parts of our immune system that protect us from infection. And so different researchers believe that it's the T and B cells that are the problem, where we know that they're just overwhelmed with parasites and they need help, they need support. And so it would make sense that if you decreased a parasitic infestation or a parasitic burden, that you would have your T cells would normalize, their function would they wouldn't be overactive because they wouldn't have to fight so much. The parasites would be decreased and their job would be minimized. So this double-blind, placebo-controlled, randomized study, they found that both neurological function and disability became significantly worse in the placebo group, the people that did not receive Levamisole, but it remained fairly stable in the Levamisole treated group. And during this study, both annual relapse rate, so how many relapses per year, MS attacks, and disability score remained much more stable in the Levamisole treated patients versus the people with, and they also had severe disability, but they had a decreased annual relapse rate, and the score, the disability score, remained more stable in the MS subjects that had the Levamisole. And so these were people that had severe disability, but they did so well with the drug Levamisole. The second study was done in 1990, and this study was done in the Italian Journal of Neurological Sciences. The title is 4-Year Double-Blind Controlled Study of Levamisole in Multiple Sclerosis. And the first study was, let's see if I know what journal, it was published in the Journal of Neurology. So these are good peer-reviewed journals. They are peer-reviewed articles, so they are accepted for publication. Again, this second study is another double-blind controlled study. So the doctors or the physicians that were giving the prescriptions, they didn't know if their patient would be receiving Levamisole or the sugar pill. And then also the patient, they didn't know if they were receiving the Parasite drug or just a placebo, which is like a sugar pill. And I don't know that there's sugar in it, but that's what we call placebos. They don't have the treatment in it. It could just be a white pill with whatever in it, I don't know, but no medication in it. So this study was a 4-year study. So this is a longer term study. 41 patients were completed this study, and 22 were treated with Levamisole, and that was once a week for 4 years. 19 patients were in the placebo group at the same schedule, so they got their sugar pill once a week for 4 years. And if a patient had an MS attack, the treatment would stop. So if they were in the Levamisole or in the placebo, and if they had an MS attack, whatever treatment they were getting would stop, and they would be considered a negative result in this study. So the adverse effects for these over time, and some people had it and some didn't, and it's not the whole time, but things that people reported adverse effects would be nausea, insomnia, dizziness, agitation, constipation, and diarrhea. Most of these symptoms would be what you would get if you were treating parasites off and on, especially if you don't do a lot of prep work. So at least one of these side effects were present in about 67%. So over 2/3 of these subjects that received Levamisole, they had some kind of a little adverse effect. So not all of them, but very rarely more than one of these adverse effects were present at any one time. So it wasn't like they had a whole bunch of adverse effects. Again, nausea, insomnia, dizziness, agitation, constipation, and diarrhea. And the adverse effects never caused a patient to withdraw from the study, and it rarely lasted more than 24 hours after taking the drug. Really important to know. This because people took it for 4 years, so you want to know, like, how safe is that, right? This study did not include patients with progressive multiple sclerosis. Patients were put randomly into the one of two groups, the treated group with Levamisole or the placebo group, and the treatment was stopped for patients who had a clear MS attack before the end of the 4-year period, and these cases were also considered a negative. So this is the findings. This is crazy. So of the group with Levamisole, so I mentioned, let me just go back for a minute. I mentioned that there were a total of 41 patients that were part of this trial, and 22 were treated with Levamisole and 19 got the placebo, got the sugar pill. So 22 treated, 19 got the placebo. Then when we look at their findings, they were amazing. So of the group that were treated with Levamisole, so the 22 people that were treated, 8 of them, which is about 36, or it's about a third of them, of the patients, they presented an MS attack during the study. period, so over the 4 years. So about a third of them had an MS attack. And if you look at the placebo group, at least 74% of the placebo group had an attack. So it's basically like 1/3 of the people in the treated group had an MS attack, whereas 3/4 of the people that did not get treated had an MS attack. And again, 14% or 64% in the treated group. Sorry, just a second here. Yes, so 14%, which is not 14, 14 out of the 22, which is 64%, did not get an attack, and those would be people that were treated. So, 64% did not get an attack when they took Levamisole for 4 years. Whereas if you look at the placebo group, there were only five people, so only 26% of the patients in the placebo group did not get an attack. So 64% didn't get an attack in the people that got the treatment, and only 5% did not get an attack. So that's amazing. That's really hugely significantly different. So of course they found a significant difference in the two groups. So this study demonstrates that Levamisole significantly reduced the number of MS patients with an acute relapse during the 4-year period of time. So this is over 4 years. That's a really good amount of time. Again, a double-blind, placebo-controlled, randomized study, and this is published in a peer-reviewed journal. So this is good science, right? So let's talk about Levamisole. So why are we not studying this further? Why did it get basically dropped after 1990? I haven't really been able to find any, more studies done on this, but if it's that significant, why would we not continue to study this? Well, Levamisole is not patentable. I believe it is an old drug. We'll talk more about it. So let me just go down to the notes on it. So it was marketed as a deworming medication in 1968. It treats ascaris, large roundworms, in humans, and they can be up to 14 inches long. It also treats hookworms, and the first evidence of it being an immune modulator was observed in 1971. So think about it. If it is killing these big, nasty worms, do you think that would help to modulate our immune system? And our immune system goes after parasites. So if we don't have as many parasites, obviously our immune system would not have to work so hard. That would be immune modulation. This is the craziness of where's the disconnect here? I don't know. So Levamisole has also been used in combination with other drugs for the treatment of various cancers. So it's anti-cancer. It has anti-cancer properties. You can look more into that also. Levamisole has been reported to improve rheumatoid arthritis and systemic lupus. Levamisole was withdrawn from the American market in the year 2000 due to its ability to cause a condition where a person would have low white blood count. So this is where I have not researched far enough or deep enough into this, but what I have found is that the FDA withdrew Levamisole from the US market in the year 2000 due to adverse effects, which were mostly associated with the use of cocaine contaminated with Levamisole. It is not available commercially in the US, but it is not, on the do not compound list of medications. So Levamisole is available in other countries. At last I heard it was still available in Canada, but it was not available in the United States. And so the reason that they took this drug off the market is because people that are using cocaine, and for whatever reason, sometimes Levamisole is laced with that, they are ending up with low white blood count. So why would you take a drug that has been shown to be safe for MS patients, for cancers, when you're worried about it causing an adverse effect, like a low white blood count in people that are using it illegally, I don't understand. Like, and that I have to go deeper into that. I really hope that that's just not an excuse to ban it because they don't want to treat parasites, because using a drug like Levamisole, or even a combination of 2 or 3 parasite drugs to treat cancer, is really cost effective. What's so interesting is that the chemo drugs also reduce our white blood count, but they're not illegal. Interesting, right? So it's just really awful. It's just another, like, why? So these are 2 examples of double-blind placebo-controlled studies where they gave MS patients a very low dose. So it probably was not even effective enough, but it definitely helped significantly over 2 to 4 years with no serious adverse effects. So why are we not studying this further? Why did it get dropped? Because there's no money in using Levamisole to treat multiple sclerosis. The MS drugs, the newer ones, they are $200,000 to $400,000 per year, and that is as long as our bodies can handle them. Whereas these drugs, the Levamisole, I don't know how much that one costs, but a lot of these drugs average about $100 per treatment cycle. You know, one of them, praziquantel, might be a little higher. It might be $200 per treatment cycle. Dirt cheap compared to what we're using to treat MS. So I want to hear your thoughts. What do you think of this research? And what I would really love for you to do is to share this research with others. I am going to go to your questions in a couple of minutes, but what I wanted to do is just first tell you that there really is hope. You don't have to wait for a cure for MS. There is never going to be a cure unless our healthcare system is no longer hijacked. Our healthcare system right now is hijacked. I'm not against all pharmaceuticals. There's a place and a need for certain ones, absolutely. But what we're doing in treating chronic disease, we are not treating the cause. We're not even allowed to know what the cause is. It is parasites. And we're treating symptoms, and we are treating the immune system. We have the premise that the immune system has gone haywire in all autoimmune, and that it is attacking our own tissue, where we are just dealing with a parasitic infestation. And if this is new to you, make sure to check out my videos. I've got a ton of videos on this topic, and you'll be able to see some of the worms that our students are passing. You'll be able to hear a lot of success stories of our students that are recovering from MS and other chronic diseases. I just did an amazing interview last week with one of our wellness champions, and she has, in 2 months, she's literally come from being in bed for 2 years in severe pain, arthritis, cognitive impairment, pain all over her body, heart racing. They said she had asthma, on, double vision, to where she is now moving. Like her walker is in a closet, and she is living her life again. And she still is treating. She's only done 2 treatment cycles, but how amazing in 2 months. And she has had years and years and years of misery. And that is somebody who doesn't even have MS. We have a lot of students that have recovered from MS. And what the Live Disease-Free secret is that they are treating parasites. That is the missing link. Is sure, go low carb, you'll start to feel better. Follow the Live Disease-Free diet. All the guidelines are free on our website. Start to watch some of our videos. Go on our Live Disease-Free blog post. You'll see different topics there that are really, really important. It'll help you get caught up to speed with where we are with the research and what's working and what isn't as far as treating parasites. And then if you need support, if you don't have a practitioner that can help you, make sure to reach out to us. Watch my masterclass training. It's free. It has all of the steps that we take to recover from parasites. You'll hear so many amazing successes of people that have recovered. And then if you need our support, make sure to reach out to us. Make sure to fill out the form, and you'll be able to book a time. If you need a proven plan to treat these parasites, maybe you're really struggling to find a practitioner that will help you. Maybe they can help you with candida, or possibly they're trying to treat Lyme, but they really don't know about the other parasites. That is our expertise. That is where we can really help you. And then you can be a wellness champion. So watch my masterclass training, Then you'd fill out the form. After that, you'll get an email from us. Make sure to watch the coach-a-thon because that explains everything in great detail. That way, when you and I meet, I can go over your health history and you can ask me specific questions about how your plan is going to work. And then if you want to join us and get your health and life back by treating the cause, I would be honored to support you. I'm going to go and see if you guys have any questions. Yeah, this is a really important video and I really hope that you share this. Actually, if you are part of our group, if you're connected with us, if we have your email address in our system, then you'll have the link to the blog post. And people like that better because the video is always condensed a little bit more and you have it written out. You've got all the links. You can actually go to the studies. You can share these studies with different integrative practitioners. I would really recommend. And again, please know that most of our students are not using Levamisole to recover. So I'm not saying that this is a drug you need to take. I am saying though that these two studies are really huge pieces of proof that confirm that MS is caused by a parasitic infestation. Really huge. They help people more than the MS drugs help people. So this is where we need to start getting this information out. And then we need to start finding places where they will do more studies on Levamisole. Or maybe if they could partner up with us and then we could help, instead of just on one drug, we could kind of say, okay, let's do a study and let's see which of, the 50 to 100 people, what they test well for. See if it's very similar to what our students are testing well for. And then do an individualized parasite treatment plan and see what the results are. And that is really where we need to go because, through doing that, we are going to see a pattern. We are going to see a pattern of which are the most commonly prescribed parasite drugs to help people recover from MS. Because I believe that I was just speaking with a healthcare professional today and she doesn't have MS and she's a wellness champion and she's just getting ready to treat. But you can energy test well for, let's say, Levamisole, but maybe that's not the most important treatment for the parasites you have. Maybe there's a combination, right? And so what do? We want to get better as quickly as possible. We don't want to just take parasite drugs for the sake of taking parasite drugs. So this is why it's so important to, do an individualized plan and then to keep doing research and saying, can we see patterns? Can we see that, most people are testing well for these 2 or these 3 or these 4 parasite drugs. Again, we're dealing with dysbiosis. We know we have fungal overgrowth. Lyme infections are very common. Roundworms are very common, but flatworms, the tapeworms and the flukes are also common. So we need to go in this direction. This is our answer. I'll see if you guys have any questions. Hello to everyone. How do we get the parasite drugs? You really need a prescription. You really need to work with somebody because if you take too much of a parasite drug, you can hurt yourself. If you don't take enough, then you also will find that the parasites can become resistant and then it'll never work for you again. That drug will never work. And they do develop resistance to these synthetic pharmaceutical parasite drugs. So it's really important not to just go on forums and try to find, to be honest, there's forums where people are using fenbendazole and they're using ivermectin and you just trial and error and you try and you're not taking the right amount and you're like, oh, it's not working for me. It might have been helpful in combination with 1 or 2 other drugs. It might have been helpful if you took the right amount, but you need to know how to take it safely. So you need to, and that's what we do. We help people to access the treatments, to access the practitioners they need, so that and to work closely with them because most practitioners don't know how to treat parasites, and so this is new to them. And so that's why you have to know what to do and you have to know how to respectfully direct them. And that's what we help you to do. And I can tell you that there is a growing interest in treating parasites. A lot of doctors, they don't know how yet, but there is a growing interest. So every one student that's working with a practitioner and that student recovers, then that doctor's like, that was interesting. And then he helps the next person and the next person. And then before you know it, he's on fire because he's actually helping his patients recover from chronic disease. All right, next question. You suffer from multiple sclerosis and you cannot walk, etc. So I don't know what your name is, but my heart goes out to you. There is hope for you. We've had so many students, and I can't make promises, but we've had so many students that were, let's say, in a wheelchair or using a walker, and through treating parasites, they have had far more recovery than they ever thought possible. Many of them are walking and they've gotten rid of their wheelchair, etc. So the key is that the sooner you start treating the parasites, then the more recovery you will have and the quicker you can recover. And this is the answer. So start to learn, start to change your diet. That is free. The instructions, the directions, the guidelines, they are all on our Live Disease Free website. It's either under resources or under research. You'll find the Live Disease Free guidelines. You can even just type in the Google search bar, Live Disease Free Diet Guidelines, and you'll find the link there too. And it's free. And start to get the carbs low enough, and it will be life-changing. If you get the carbs low enough, then you need to treat them, the parasites, for sure. Hello, hello. Hi, Lee. Oh, the video is stopping. I hope that the connection is strong enough, but I guess we'll find out. What is a good preparation before taking parasite drugs? So watch my masterclass training. There you will find the prep phase. It's very important to go low carb, and it's also very, very important to not just go low carb, but to support the body. So you should be feeling a lot better before you start to treat. Very important. So you want to be feeling a lot better before you start to treat. And those are the questions for right now. So if this is the first time that you've met me, and the first time you've ever heard that parasites could be causing the disease that you're living with, it's not just MS, but any chronic disease, then please start to watch my videos and start to learn. And when you're at that place where you're like, okay, I'm following the diet and I've started to feel better, but I really want to get these parasites out of me. If you're at that place, then make sure to watch my masterclass training. And after you watch it, if you are considering our support, make sure to fill out there's a form you fill out. You'll be able to click on a link, fill out a form, and then you'll get an email. And watch the coachathon. It goes into a lot more detail, like how to access the treatments, how to find practitioners to help me to treat parasites, etc. All of that is clearly laid out in the coachathon. And then you'll be able to book a time to chat with me. You can either just join or you can talk to me before to get all your questions answered to make sure that this Live Disease Free program is a good fit for you. But this is your answer. Whether you find a practitioner locally or whether you need our support, you need to treat the parasites that cause multiple sclerosis and all chronic diseases. And you definitely need a plan, and you need to take effective treatments at effective doses. And with that, it is honestly surprising how much recovery we can have. It is miraculous how much recovery. And that's the exciting thing. And that's why we're on such a mission to get the word out. So please help us get the word out if you found this helpful by sharing this video link with others, and like and subscribe. And then also check out our website, livediseasefree.com. I am really proud of the blog posts that we do there. The topics are amazing. You will really understand why you're not feeling well and what you need to do to recover. So with that, I'm going to let you guys go. I hope you have a wonderful week, and we will see you next week. Take care. Bye-bye for now.